Athlete's foot. This is a very common problem that we see very frequently. This is caused by a fungal infection of the skin, and contrary to popular belief, this is not just for folks who are athletic. It could occur in just about anyone. We do see it with greater frequency amongst our diabetic patients, in the older population, and any individual whose feet tend to perspire a lot will be predisposed to having this problem. And this can take on many different forms and appear very different depending on the patient. You can have the classical itching and burning in between the toes, but you also could see it as a red scaling rash on the bottom of the foot, or small blisters that occur in various locations on the foot. The diagnosis of athlete's foot can typically be made by your doctor very easily with routine exam in the office. It is important to differentiate this problem from other common skin conditions such as a dermatitis or an eczema, which commonly will also present in a similar fashion as far as a scaling rash on the foot. When the diagnosis is in doubt, a skin biopsy may be performed to confirm this, which is usually a painless exam that we can easily perform in the office. The treatment for athlete's foot will first involve the foot hygiene things that we typically think about, which is obviously washing the feet regularly, once or twice a day. And we want to pay special attention to drying afterwards, focusing on in between the toes and the bottom portion of the foot. Use of over-the-counter drying agents can be helpful, and this could be something as simple as baking soda or talcum powder used in between the toe area. Wearing well-ventilated shoes and socks and changing our socks on a regular basis can be helpful. And then we get into the use of topical antifungal products, and as we all know, there's 1,000,001 different products out there on the market, and if you've been using something over the counter for more than a week or two and the condition is not resolved at this point, we should think about prescribing something that's a little more potent to help you get rid of this condition a little bit quicker. And if all else fails, there's a last option of a oral medication which can help kill the fungal infection a little bit quicker.